do not type in the chat function, as the audience watching cannot see that. Katie, please take a roll call. Members of the board, please indicate you are here and the organization that you are representing.
Thank you, Rob. Sorry about the technical difficulties. Tish Brown Gambino.
Here, UMOM New Day Centers.
Jacqueline Campbell. Liz DaCosta.
Liz DaCosta with Community Bridges.
Marshall Franklin.
Yes, good afternoon, Marshall Franklin, City of Phoenix.
Tad Gary. Lisa Glow.
Here, Lisa Glow with Cass.
Chris Hallett.
Here, good afternoon, Chris Hallett, City of Peoria.
Joan Service.
Hi, here, Joan Service with the Arizona Housing Coalition.
Charles Sullivan. Jackie Taylor.
Jackie Taylor here with Save the Family.
Danielle Wright.
Hi, Danielle Wright, Arizona Coalition to End Sexual and Domestic Violence.
Co-chair Ryan Balch.
Hey everyone, Ryan Balch, City of Chandler.
Co-chair Rob Podlager.
Hello, everybody. Rob Podlager, Valley of the Sun, United Way.
Did I miss anybody? All right, you have a quorum.
Great, thank you. The next item on the agenda is a call to the audience. Members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov/comment within 1 hour of the post start time for the meeting, or they can join the Zoom meeting by requesting the link from MAG staff or registering on the COC board meeting events page. If you are wishing to make a comment, please raise your hand in Zoom and you will be invited to unmute at that time. Public comments are limited to 3 minutes. Katie, were there any comments received or anybody who has joined the call to offer comments at this time?
Co-chair Podlager, we did not receive any comments and no one from the audience has raised their hand to speak yet. Back to you.
Great, thank you. We'll now move on to the next agenda item, which is the approval of the May 23rd, 2022 meeting minutes. Does any member of the board have questions or comments on the minutes? No? Okay then. Could I have a motion to approve the May 23rd, 2022 Maricopa Regional Continuum of Care Board meeting minutes?
Jackie Taylor, so move.
Thank
Chris
you, Jackie. Can I have a second?
Chris Hallett, second.
Chris? Thank you, Chris. Is there a discussion of the motion? No? Katie, could you go ahead and proceed with the roll call to vote? Please indicate clearly how you vote by stating yay or nay after your name is called.
Tish Brown Gambino.
Yay.
Sorry, Jacqueline Campbell. Liz DaCosta.
Yay.
Marshall Franklin.
Yay.
Lisa Glow.
Yay.
Chris Hallett.
Yay.
Joan Service.
Yay.
Jackie Taylor.
Yay.
Danielle Wright.
Yay.
Co-chair Ryan Balch.
Yay.
Co-chair Rob Podlager.
Yay.
The motion passes unanimously. Did I miss anybody? Back to you, co-chair.
Great, thank you. Now we'll move on to the next agenda item. The next agenda item will be updates. Chairs of committees with recent activity will be asked to share with us. Updates will also be provided in the monthly newsletter sent out by MAG. So first of all, we're going to hear the legislative updates from Joan Service with the Arizona Housing Coalition. Joan, take it away.
Hi, good afternoon, everybody. Everyone can hear me okay? Yep, okay. So the legislature has adjourned sine die on Friday evening, which is good. It was so they passed a bipartisan budget. It was about an $18 billion bipartisan budget passed. And there was some shining spots for our issues as it relates to housing and homelessness. First, and very significant, is that there was a $60 million appropriation to the Housing Trust Fund. And that's really great. Obviously, you all know a couple of years ago, thanks to a lot of the advocacy faces I see on the call, there was a one-time investment of a $15 million appropriation to the Housing Trust Fund. So $60 million is great. There is, of that $60 million, there is a $20 million set aside for rural communities and a $4 million set aside for tribal communities of that $60 million. So that's great news. Also included in the budget is a $10 million appropriation for homeless services grant pilot. So basically what this means is ADOH will use these monies to establish or help fund a grant program for cities, towns, and counties in Arizona to establish a homeless services program designed to reduce homelessness. But obviously this is all kind of stemming from the Glendale Works program. So eligible programs must allow homeless individuals to be compensated for daily work, offer a daily remuneration rate, and help participants to access support services. The catch is that cities and towns must provide a dollar for dollar local match for each grant dollar received. So again, I don't think it's just Glendale Works. I think there's other programs across the state that have this, and frankly across the nation, that offer this type of program. So excited to see that appropriation. There's also two other appropriations. There's the Department of Education is going to receive $10 million to work with, to basically create a transitional housing for foster youth transitioning out of foster care as part of the rehabbing and furnishing the East Valley Institute of Technology. So it's going to be about a 64-bed transitional housing program. And, so again, a $10 million appropriation there. And then finally, a almost $2.4 million appropriation that the Department of Administration will be overseeing to support activities up in Northern Arizona as it relates to homeless veteran housing, basically Fort Whipple up in the Prescott area. So that's kind of just the budget. And frankly, as y'all know, oftentimes money dictates policy. There was, we've had a lot of conversations around some of the bills that have been introduced during the session, specifically Senate Bill 1581 that looked at structured camping facilities. And then at the last minute, some budget negotiations and budget conversations, there was actually a $5 million appropriation rumored to address, to actually enforce camping bans. Ultimately, last minute negotiations and frankly, many days at the legislature, I think the wind was taken out of many legislators' sails. And so they just basically wrapped up the budget, dealt with a lot of the big outstanding issues like school vouchers and water issues, and called it quits. So a lot of those conversations have been tabled. Some of them, we expect to be discussing next legislative session. I think, unfortunately, what also failed, would be included in that category is the work that Lisa has been championing around Senate Bill 1263, which would increase the appropriation to the Department of Economic Security coordinated homeless line item from 1 million to 3 million using lottery funds. So that's something that we're going to have to bring back next legislative session when they have a little bit more energy. So happy to entertain any questions or comments. I see.
Rob, it looks like Lisa's hands up.
Yes. Could you talk about the wins that Wildfire had with the eviction bills? And secondly, about how you can use support on the potential match on the 60 million so we can up that hopefully with ARPA dollars through the governor's office.
Yep. So Wildfire is one of our legislative partners, And two bills that they were championing has also been signed by the governor, House Bill 2484 and House Bill 2485. The first was elimination of answer fees. So when a tenant is trying to resolve their eviction filing, often they have to go back and fill out different forms and pay different fees, and it's often kind of an outstanding thing. So that elimination of answer fees is now a good thing and passed. And also, and I think kind of most time sensitive, is the sealing of records for cases that were dismissed. And that's important because obviously, as we think about a lot of the increase in eviction cases during the pandemic, there's going to be, anything that's been dismissed, anything that removes that stain on folks' housing records, that's a good thing. And then to your point about $60 million, I'm sorry, you said how are we going to leverage that and how are we going to champion that? Ultimately, we're going to be obviously, this $60 million is state general fund dollars. And we know that the governor has a significant amount of money left over, well, not left over, but as part of his American Rescue Plan Act discretionary funds. So we are working with the ninth floor and hoping to leverage the $60 million state general funds with $60 million of the ARPA funds. We're going to be working on an action alert so you guys can copy and paste some of our requests. But if I would encourage you all to, if you have relationships with the ninth floor, go ahead and pull those strings and ask the governor to, again, have a match with that $60 million. Did I answer all your questions, Lisa?
Great, thank you. Are there any other questions for Joan? Joan, thank you again for a thorough update, appreciate it. Okay, so next we're gonna hear from Matthew Kelly with Mercy Care and Jasani Goodman with Phoenix Rescue Mission for an update on the Coordinated Entry Subcommittee.
Hey y'all, so I want to give you all just a quick update with regards to the work that has been going on in coordinated entry, specifically surrounding the integration of the domestic service providers into the coordinated entry system. So as many of you might remember, we had kind of broken our task down into two different sections, more or less, which was access and prioritization. We have come to an agreement with regards to access as it specifically relates to individuals who are in domestic violence shelters. Historically, the problem has been individuals would go through the coordinated entry process, and after about 7 days of being assessed, their name would fall off that by name list and they would never be evaluated for any particular resources through coordinated entry. We've established a process for individuals who are in shelter and interested in participating in coordinated entry to update. We've got a new release of information process that's been put in place by the DV providers, and then also a data collection process between the DV providers and Solari to pull all that information in. So we're going to actually be collecting individuals who are in shelter and interested in participating in coordinated entry on a every other week basis. So we're going to be able to do that. Now, there are some time limits on that. Typically with domestic violence providers, there's a requirement of, I think, a max for a month on that release of information. However, we've got that all put in place and we're going to be starting to track that. As of July 1 will be the first report that will be coming out. So we're super excited, not only that we were able to come to an agreement as a group, but more importantly, that we were able to stand this up super quickly. So I think we agreed upon it at the beginning of June and we're rolling it out July 1. So I want to thank everybody for being able to do that. Additionally, because as you might know me, I don't like to wait. We started working on prioritization, even though we're not completely done with access. So we've had our first conversation. And while I would say the first conversation was super positive and great, we haven't come to any formal agreements on anything, but I felt like the first meeting of prioritization, which could be, I think, a pretty sensitive topic for many people along the community, was super productive, and people will come to some general consensus on how we want to proceed, and we have a plan. So I'm super excited about that and looking forward to the progress in the future. Thanks.
And I have a second update. The second update for the Coordinated Entry Subcommittee is that we are diving into the high utilizers conversation that we gave an update for last meeting. So we're actually going to be partnering with ASU to help to analyze that data. One of the first things we're trying to do is identify what a high utilizer is. So what does that consist of? Is it HMIS entry exit, the length of stay in projects, initial entry dates into HMIS? And then we're also trying to not just look at that information, but also do a dive into the previous prioritization. So the last prioritization was on long stayers and shelter, and what are the impacts of that, and basically be able to dive into that so that way we can make an informed decision of how we can work to assist those individuals that are utilizing our system frequently, far past frequently, and what does that look like to get them the assistance that they need with housing interventions, whether that be a rapid rehousing voucher, permanent supportive housing voucher, but basically moving those individuals up the by name list. So that's the second update.
Wonderful, thank you. Do we have any questions for Matthew?
I just have a couple of quick questions about the high utilizers. This is Letitia from UMOM. I'm hoping that high utilizer discussion is going to include families as well.
Yes, that's correct. So we are looking at it from both angles. So not just from the single side, but as well as from the family side as well.
And will the ultimate goal of this be to have some type of high utilizer case conferencing to discuss interventions and possible housing plans that are just more responsive to the needs of those utilizers? Just asking that question.
No, that's a really great question. So I think that is also what we're trying to become informed on as we're diving into this data, is whether we do need to have a separate case conferencing for these individuals, or what are the gaps. So we're hoping that this process will help to inform that. And if that is what needs to be done, then that's what we hope to implement.
So we've tried to do that at UMOM internally, and it would be great to partner with other providers to discuss these high utilizers. So I think that's a wonderful opportunity for the entire system. So thank you.
Thank you.
Great. Any other questions for Matthew or Vijayasani? Wonderful updates. Thank you. And next, we will hear from Nikki Stevens on the follow-up numbers for the point-in-time count for older adults, as well as an update on the Race Equity Leadership Group.
Thank you, Katie, for sharing the screen. And thank you all for allowing me just to speak really quickly on a couple of updates. So as you can see, the only data we could provide would be coming from unsheltered point-in-time count, because the sheltered count did not have an extra age category for older adults. Only those reported adults ages 25 plus as a category. The two older adult categories from the unsheltered PIC count are 55 to 61 and 62 plus. And as reported here, older adults 55 plus 878, older adults 55 to 61 649, and 62 plus there were 229 adults that experienced unsheltered homelessness the morning of the count. This also includes the extrapolation of the Phoenix's high-low density grids. Does anybody have any questions around this slide? Okay, well, thank you. And then I will go on to, excuse me, the Racial Equity Leadership Team update. So the leadership team has met with home-based consulting to provide feedback regarding what gaps currently exist in the coordinated entry system from an equity lens. The group also shared some best practices from the city of Houston with home-based, because Houston most closely resembles us regarding race, ethnicity, and geographical coverage. And we've asked for them to do additional research around other national models to come back to our group and provide us an update. And another update around racial equity partners, we have executed our contract with them for the final steps of the work plan. And those next steps would be the development of a workforce equity toolkit that organizations can utilize to examine inequities within their organization and how to create a more diverse workforce from the frontline staff to the executive leadership. So we're excited about what we'll be able to provide to you all the next couple of months. Does anybody have any questions? Thank you all. I appreciate the opportunity.
Thank you, Nikki. Appreciate it. Okay, so next we're going to hear from Tish Brown-Gambino with an update on the Lived Experience Subcommittee.
Hello, everybody. Good afternoon. I'm just going to give a brief update because my partner in crime, Trevor Southwick, is out on paternity leave. Congratulations to Trevor. The subcommittee was formed in November. The charter was implemented and we've been meeting since March. And currently we're working on specific projects related to creating a speakers bureau. We also have 3 subcommittee members that are attending the NEEH conference, which we're very excited about. This conference will allow us to serve as lived experience Hill advocates. And NAEH is actually paying for our travel, they're paying for our hotel stay, and they've paid for our registration. So we're all going to be there together, mingling and participating with folks with lived experience and discussing how we're going to impact the movement come September when NAEH has their virtual training and their virtual Hill Day Summit. We met with Homebase, as Nikki mentioned. Homebase has been meeting with a lot of the subcommittees, and we discussed with them last month the evaluation plan, the role of folks with lived experience in that process, and how we as a subcommittee want to be engaged in that process. Right now, we are working on this ad hoc work group. We're trying to generate excitement around a lived experience newsletter. We're also discussing an opportunity to create a book of stories and poetry from folks with lived experience that we can also sell for a little bit of revenue to do some special activities and projects with folks with lived experience at our providers agencies. And we're developing this project specifically under the ASU Nexus. They have a lived experience advisory council that sort of serves as our feeder into the lived experience subcommittee. So we have this great synergy with ASU. We're working with Cricket Weatherington over there at ASU, and this collaboration has been very fruitful for us. And not only getting more participation around lived experience work, but also around training folks in lived experience to serve appropriately and comfortably on the subcommittee. So we're doing some exciting work, and we'll keep you updated and give you a more robust update with Trevor present next month.
Wonderful. Any questions? Yes, Joan.
I just want to say yay, but also just, you know, as Leticia mentioned, NEH, you know, the conference, they're not able to have that Capitol Hill Day because, you know, offices are still closed. So again, I just want to punctuate what she was saying, that we're going to have these, well, the Housing Coalition is serving as that state captain, so we'll coordinate all the meetings, like just scheduling it. But I'm so excited to have folks with lived expertise share their stories, because I will tell you that's what not only lawmakers pay attention to, but staffers too. So yay, please join.
And we're preparing for it. We're getting our folks revved up and confident so they can speak with knowledge and speak with passion. So we're excited about it.
Great, wonderful. Any other questions? Okay, appreciate that. Thank you for the update. And finally, as you may have heard, there is a notice of funding opportunity that was released last week by the Department of Housing and Urban Development Kelly Williams is joining us today from MAG and will provide an update and an overview. Kelly, the floor is yours.
Let me put my jacket on. Apologies. Good afternoon, everyone. Give me just 1 second, please. Let me pull my notes up. I'm sorry, I need just 1 second. One more second. I apologize. I was multitasking. One moment, please. All right, thank you, everyone. So as you may have known, you may have read that HUD announced an additional more than $300 million specifically related to helping unsheltered individuals. The funding will be split between unsheltered individuals and urban populations and also in rural populations. MAG has had a chance to review the NOFO. As you can imagine, this comes at a fast-paced time for us already. We are preparing for the planning grant and the annual NOFO application for existing COC projects, but we will be taking this project on additionally and applying for it for the unsheltered population. We will, at this time, and we are still in the process of reviewing it, we will not be applying specifically for rural populations because our COC is primarily an urban community. We will be reviewing the timeline and getting the timeline out to COC partners and to others in the community who may want to work with us on this project within the next 2 weeks. And we will be starting a whole additional supplemental NOFO with the ultimate goal of providing an additional $60 million to our COC to try to address the unsheltered needs of our community. Our team will be taking this on, as I mentioned, in addition to the existing NOFO responsibilities of the MAG COC work. And at this time, because it was just announced late last week and the formal listening session / Q&A with our HUD TA happens tomorrow morning, I don't have a lot of additional information at this time, but as soon as we have an established timeline, which I expect to have completed by the end of the week, we will make sure to be communicating that out with all of you in hopes of bringing at least the full $60 million to our COC. Again, as we make these decisions, we will make sure to communicate with you as readily as possible, and we appreciate your help and guidance through this process. I'm available for any questions you may have at this time.
I don't think there are any questions. Great. Thank you, Kelly. Appreciate it.
Thank you.
Do any other committees or subcommittees have an update at this time?
Rob, this is Katie. I forgot to update your chair's agenda, but Data Subcommittee has an update also. We just brought on a second co-chair, Mary Glennon, joined Randy Haight as a co-chair of the Data Subcommittee, and they have been reviewing policies and procedures and are going to continue to review those throughout the summer. They are also reviewing new people who are coming up who want to be onboarded onto HMIS. So there are quite a few agencies that are not yet onboarded and have to come through Data Subcommittee. So we will be reviewing those in July.
Great, thank you. So not only did you mess up my technology, you messed up my speaking notes. You're out to get me today, Katie. They didn't get you a birthday gift the other week. Okay, any other discussion items at this point? If not, then we'll move on to the next agenda item. Item 5 on the agenda is heat-related data sharing. Stephanie Crum with Solari Crisis and Human Services will share an overview of the request with what the data sharing entails and next steps. Stephanie, thank you for being with us. It's all yours.
Hi, thank you, everyone. Thank you for having me. Katie, were you going to share, or is it okay if I share my screen? Okay. All right. Again, thank you for letting me come and speak today, and I'll try to keep this brief, but also would like to leave some time at the end to answer any questions. So what I'm coming here to ask today is currently right now, Solari and Access have an HMIS data match project for COVID-19. And a little bit of history, what's been going on with that project is at the onset of COVID-19, we really saw the increased need for data integration and coordination between both social service, homeless agencies, and healthcare providers. At that time, the process looked a little bit different for approval because, it was a public health emergency. So that's why I'm here today, and I'll get into that a little bit in a minute. But basically, starting in August of 2020 is when we started integrating data for COVID-19 related care management. And why I'm here today is because we would like to expand that data match right now to address the needs of individuals who are at the greatest risk of heat-related illness and death right now. So the project what we're aiming to do with this new data match is to increase understanding of our current shelter population, facilitate coordination between all the stakeholders, aid healthcare providers in prioritizing those clients for interventions, estimating the impact of disease and heat on homeless sector and partner systems, and improve coordination across all the sectors' available resources. So how it works right now is to identify persons for this data matching. Right now, what we do is we look at HMIS users and names, and we pool clients that were screened for COVID-19 by a homeless provider. What we're proposing to do with the heat-related data match is we're going to use the HMIS system again, but we're going to be looking for clients that meet the following proposed criteria. So that's persons that are residing in heat relief, seasonal temporary shelters, persons who have recent outreach contacts. So that means that they're unsheltered, working with street outreach teams. And number 3, persons identified on a recent by name list with a disabling condition, and that can include self-reported disabilities related to serious mental health. So that would be the population for the heat relief data match and sort of how that differs from the COVID-19 data match. And then what we're going to be doing with that information is also very important. So let's see, let's go back up here. Yeah, so the names that we've been looking up and sending for COVID-19, what we have been doing is pulling those lists of names of folks who have been screened for COVID-19 by a homelessness provider. We look up in Access and verify whether they have Access ID, who their healthcare provider is, whether they have an SMI diagnosis. What we do and share back to Access is demographic and contact information, as well as veteran status, chronic homeless status, income, most recent coordinated entry date, if they've had that assessment, and whether or not they have been identified as having any mental health problem, COVID-19 testing system, symptom information, their last known location, and their current case manager. And then we also send out aggregate data on the data match, and we send that to MAG and homelessness service providers. To get into a little bit of what the findings look like for the COVID-19 data match project, in total, we matched 4,128 names. Of those names, 92% had an Access ID, a managed care organization, or an MCO. 8% we could not find in the Access system, meaning they didn't have benefits, had never been in the system. 51% of the individuals that we originally pooled were identified as having a chronic mental health condition. 15% of those were SMI. 28% were matched as chronically homeless, and over 51% of the total names that we pulled were identified as Black, Indigenous, people of color. Partner uses and feedback. I won't go into too much detail here, as you can read in the packet, but some highlights were that some of the highlights feedback that we got back was that clients were able to be assigned care managers who specifically followed up with that member and the member's team to ensure proper care and support, during and post COVID-19. We received some feedback from managed care organization staff that they were really able to support their members, and they were able to find their members having quarantine hotel information. We were really able to coordinate services post COVID-19 care as well. And then from a high level standpoint, we were really able to track trends, look at trends, overall COVID positive trends by week, by month, by line of business, whether they were SMI, GMSU, which is general mental health and substance use. So those were just some partner usage and feedback that we got. All right, so why I'm here today. We'll get back to that. So the approval process is a little bit different for this one than it was for COVID-19. Because like I said, again, for COVID-19, we really streamlined that process. It was a public health emergency. So we really were focused on, care coordination, and there was a lot of relaxed requirements around protected health information at that time. Being that there's really no such declared public health emergency for heat, we kind of have to go through our standard process here for data sharing. So what I'm asking the board today is, one, the board approve a business associate agreement between Solari and Access for this data match project specifically. And it's going to outline the identification of that population, the identification of all the data that's going to be shared from HMIS, permission for us to access the protected health information from Access, and then to approve the process of data management and transmission and the aggregate data management and transmission. And then the second piece would be a board approval of a modification to our privacy notice and also our release of information. We have some suggested modifications. Basically what it comes down to is we want the clients notified that their identifying information that is entered into HMIS may be used to look up their eligibility for services and programs in external data systems like Access, and have their basic identifying and location information be shared to coordinate their care. And then the second part, of course, they can opt out of this data share matching process. So those are the two things that I'm asking for board approval today. If you scroll down a little bit farther, you can see some more of the aggregate data that came out of the COVID-19 data match as well. But thank you so much for allowing me to present this information. And yeah, any questions?
All the good information. Thank you, Stephanie.
Thank you.
Any comments or questions from the board before we move forward with the vote? Okay. Could I have a motion to approve for Solari to enter into business associate agreement with AHCCCS to track and coordinate heat emergency data for homeless individuals?
So moved.
The first from
Jackie,
Lisa,
I
thank you.
second.
And second from Jackie. Thank you. Is there any discussion of the motion? Now I will ask Katie to proceed with the roll call. Please indicate clearly how you vote, stating yea or nay once your name is called.
Tish Brown Gambino. She had to jump off. Jacqueline Campbell.
Yay.
Liz DaCosta.
Yay.
Marshall Franklin.
Yay.
Lisa Below.
Yay.
Chris Hallett.
Yay.
Joan Service.
Yay.
Jackie Taylor.
Yay.
Danielle Wright.
Yay.
Co-chair Ryan Balch.
Yay.
Co-chair Rob Pavlogger.
Yay.
Did I miss anyone? The motion passes unanimously. Back to you, co-chair.
Thank you. We'll move on to the next agenda item. Rank and review work group met to discuss the changes to the review, rank, and reallocation process, as well as provide guidance to the rank and review subcommittee. Katie is now going to provide an overview of the changes, as well as suggestions for the board's approval. Katie?
Thank you, Co-Chair Pavlogger. I want to just quickly give an overview of the main changes. These were included in your packet, both a red line version as well as the clean version. Really the biggest change, we made a couple technical changes here and there, but the biggest change being that during the application review, we changed, typically in the past, you've been brought 3 different lists to the board for review. And after having a lot of conversation with the rank and review work group of the board, we are actually changing that to the 2 first lists being the same. So the first list that is brought to you is just raw scores based off of just straight scoring. The second list that is brought to you is raw score plus any discretionary points that the rank and review group gave. And then the third list in the past has been discretionary, raw plus discretionary plus your board's kind of recommendations. this year, we found out that last year and in years past that kind of the rank and review subcommittee really brought into consideration what the board listed as kind of what their top priorities were, but it really kind of limited them in giving you any feedback or changes. And so the recommendation this year is to change that to up to 5 additional lists that they can bring you. So they can bring up to 7 lists to you. They do not have to bring 7. And really in that 5 additional lists, they're taking into consideration any recommendations that you all have for them, and then also any recommendations that they bring forward that they want you to consider. And then after that presentation, once they bring these lists to you, they also have a final recommendation of which one they would adopt, giving the pros and cons of that adoption. Before I go any further, I wanted to pause and see if there's any feedback to that change through the process, and then I'll jump into what are the recommendations that you all are recommending to give to the rank and review subcommittee. All right, hearing nothing, I'm going to go ahead and jump over to, and I'll go ahead and share my screen to share the recommendations that that the rank and review work group would like you all to approve to give to them. These recommendations were really not in any particular order, but something for the rank and review subcommittee to review and also take into consideration. So the first one being a preference to renewal projects who score highly on the local scorecard. So obviously want to keep those renewals that are scoring in that top tier of projects. The second one being that we looked for lower scoring renewal projects, identify if there is a drop-off cliff that separates from the top scoring from the lower scoring. So is there really a separation at all? And if there is a separation, that we would consider if the drop-off has permanent supportive housing units in it, that we would want those preference to be funded again, but still a consideration for rapid rehousing projects as well, to see if there is, should we still be considering funding those? So not just, in the past we've said just preference for renewals over new projects. This is really taking into consideration, is there a gap? The third thing being taking into consideration the number of family and single beds in comparison to family and single population within the system, using the homelessness trends report data. So are there more beds for families versus singles? If families make up 15% of our homelessness trends report households, then our family should also make up 15% of our continuum of care funded beds. And then finally, partial reallocations could be considered if the need presents itself. So the board work group felt that we don't absolutely want you all to reallocate, but if you all feel like a reallocation should exist, that you could bring that forward in a recommendation to the board. Members of the work group, I will turn it over to you all to see if you all had any additional comments, thoughts, questions, feedback to give to the whole board.
Nothing additional, Katie. Thank you to the other members of the group, Rachel and Chris. And I think, Jackie, were you there too? Yeah, I know we had a couple meetings, so certain people couldn't be at certain meetings, so forgive me. I think our intent was, we really looked at the feedback of the rank and review committee from last year, who provided some very specific insight as to what would have made their process more meaningful. And I think we went from there, and I think we came up with some, so I know it seems like a lot of options, but these were the specific areas where the rank and review committee last year felt like their hands were tied and that they could have given better input had we allowed them some more options. So we were very specific in providing those. So I hope that helps clarify why there are so many. And then the other piece of feedback that we got was that they really do want the board's direction. So we were very specific about what the priorities would be. So really looking for input from the board, though, if anybody has any questions or other members of the subcommittee.
comments, feedback. I want to say we met 3 or 4 times. So we really took a deep dive into it. And I think we should get good results.
I don't have a question on how the decisions will be made based upon the recommendations from the group, but I do have a question about the process that will be involved when a project scores below the threshold. What type of TA will it trigger, or corrective action will it trigger at all? I'm just curious.
Right,
I'm not quite grasping what you're asking. Katie, are you?
Yeah.
Okay.
Members of the board, Tish. So I would say that the drop-off cliff is really like a starting point to say, like, we want to give technical assistance. Anybody who is scoring in the lower part of the notice of funding opportunity local scorecard will be given technical assistance. So folks were monitored this year with an on-site visit, and then also were given technical assistance based on what they needed to work on. And now that we have a full-time staff member who is just focused on monitoring, we'll be able to provide some of that technical assistance. And then secondarily, you all brought into your board strategic plan this year, which we're covering in item 8, I believe, that you all want to be looking at the local scorecard question by question and really seeing like what technical assistance needs to be applied across all programs, not just individual programs. And so that's something that MAG staff will be working on to be providing technical assistance on questions that everybody across our continuum struggles with.
Thank you.
Of course.
Great, thank you. Any other questions for Katie? Great, thank you. So I'd like to go ahead and move forward. Can I have a motion to approve the changes to the review, rank, and reallocation process and the guidance to the rank and review subcommittee?
So moved.
Thank you. Can I get a
Second.
second? Thank you, Jackie. Is there any discussion on the motion? And if not, I will ask Katie to proceed with a roll call vote. Please indicate clearly how you're voting, stating yay or nay after your name is called.
Tish Brown Gambino.
Do I need to abstain because I'm a funded agency? Okay, yay.
No, only in the actual adoption of programs do you need to abstain. Thank you. Jacqueline Campbell.
Yay.
Liz DaCosta.
Yay.
Marshall Franklin.
Yay.
Lisa Glow.
Yay.
Chris Hallett.
Yay.
Joan Service.
Yay.
Jackie Taylor.
Yay.
Danielle Wright.
Yay.
Co-chair Ryan Balch.
Yay.
Co-chair Rob Poppacher.
Yay.
The motion passes unanimously. Back to you, co-chair.
Thank you. So we'll move on to the next agenda item. Katie is back with us to provide an overview of the board strategic plan, which is also included in the packet. Katie?
I misspoke. It's item number 7, not 8. Leading you left and right astray, Rob. So quick overview, the board strategic plan was included in your board packet, and board members, I know we've talked about it probably more times than you would like to count, but wanted to give a quick overview as to what all is included in the board strategic plan. You have a brief summary of homelessness in Maricopa County, taking in different data points that we have in our community, quick overview of what is the continuum of care and our different subcommittees and committees under you. And then finally, we go into the plan overview. This is really talking about pulling out your mission, vision, and values. But then we talked a little bit about the strategic framework, which really roots your board strategic plan into regulatory roles and oversight, system performance measures, monitoring, evaluation, and technical assistance, and a communication strategy and plan. I did want to note that we added this additional sentence at the bottom that really said that this is a living, breathing document. And as ideas arise, we want to incorporate them following this strategic framework. So as long as it fits into the framework, we will add it as you all see fit. separated this into the 4 different categories. So on each of these, we have the activity, the lead, agency, and then timeline. So that falls under regulatory roles, oversight, and approvals. Our system performance measures, we have a definition of each of those system performance measures and where you can find the latest system performance measures linked here. As well as each of those different steps in timeline order going from June of this year all the way through 2027, both short and long-term goals. And then we have the monitoring, evaluation, and technical assistance with that incorporation of the feedback that you all had during your strategic planning session, really about looking at the NOFO on a deep dive basis like we just talked about. And then finally, a communication strategy and plan. The last thing that we did add is a list of your continuum of care meetings. We will adapt this and change this as you all add additional meetings and try to keep it as broad as possible so that this isn't getting updated all of the time. So you'll really see that it's like the last Monday of the month rather than a specific date. Any questions, additions? We will get this added to the website so you all can review it and look at it at any time.
Katie, this is Jackie. I just want to thank you for all the support that you've provided us over these numerous meetings. The structure that you've helped us put to our strategic thoughts. I mean, I don't think we could have done this without you. You've just been absolutely amazing. Thank you very much.
Thank you. One other thing to note that you all gave feedback during your last board strategic planning session is could we basically create a Gantt chart per se of all the things that you all should be looking at and the committee should be looking at. Huge thank you to Chris for bringing that to our attention. We did complete that. So we have a complete Excel sheet with every single committee and subcommittee tabbed out, and we'll be bringing that back to your attention. So we'll send that out to you all once finalized, but also know that we will be working through every committee and subcommittee with many agenda items for each of their different meetings.
Great, thank you. Any other comments or questions or discussion from the board? I do want to personally thank you though, Katie, also coming on new, and when this process was already in place, you made it very clear and helped support in numerous ways. So thank you very much for that. So if we're good with that, can I have a motion to approve the board strategic plan?
So moved.
First from Lisa, and a second?
Second.
Second from Danielle. Thank you. Now I'll ask Katie to proceed with the roll call votes. Please indicate clearly how you vote with a yea or nay after your name is called.
Tish Brown Gambino.
Yay.
Jacqueline Campbell.
Yay.
Liz DaCosta.
Yay, and thank you, Katie.
Marshall Franklin.
Yay, and thank you, Katie.
Lisa Glow.
Yay, thank you also.
Chris Hallett.
Yay, and thank you.
Joan Service.
Yay, and thank you.
Jackie Taylor.
Yay.
Danielle Wright.
Yay.
Co-chair Ryan Balch.
Yes, with enthusiasm.
Co-chair Rob Podlogger.
Yay.
The motion passes unanimously. Before I move on, I believe you have an audience member who wants to ask a question.
Okay.
Amy, you should be able to ask your question. Sorry for not making it clear.
Good afternoon. Thank you, Katie and MAG staff, for facilitating the board to a strategic plan. Wouldn't want to be the only one to not thank people. As an outsider looking in and reading the document, I think it'd be helpful somewhere to define the regional homeless coordination team. I didn't see it in the COC governance structure and definition. So for someone who's not involved in the conversation every day, I don't know who those people are. It'd be helpful to know who that group is. And then I don't see a lot of reference to race equity, which kind of surprises me that given all of our community conversation about race equity. So I didn't know if that was intentionally not referenced dramatically, or if it's somewhere and I'm just not seeing it. Thank you.
Thanks, Amy. I believe we can respond. I'm going to respond. I don't know if that's open meeting law publicly available. Amy, we will define the regional homelessness coordination team. That is all of the local jurisdictions who have been working on Pathways Home. So we will make sure that gets noted and I think bringing that up, like MAG Regional Council is not defined either. And that is in some of the steps also. So we will make sure that gets added to that document. Co-chair Paul Blogger and co-chair Balch, would one of you like to address the race equity conversations that we had during board strategic planning, or would you all like me to?
I'm happy either way. I will say, and then maybe Katie, you can put some more definition to it, but that we did actually have quite a few race equity conversations, and it should come out in the words we chose and the way we decided to frame things and our board membership changes. And so it should, maybe it's not really apparent in, maybe we didn't like bring out a section on it, but we actually considered it in every section that we reviewed and in every change that we made. So it should, all of the new things that we are implementing should reflect an emphasis on race equity. If that's not apparent, maybe we need to take a look at that. Rob or Katie or anyone on the board, frankly, did anyone else want to take a stab at that?
I think, Brian, you said it perfectly. And I think, Amy, this is something that kind of came up over and over again in our board strategic planning sessions was if we put a line item in there, then it was really limiting every single, like we should be looking at race equity in every single step, which is why we decided to add like the values, mission and vision back into the top of the strategic framework, and really that every single step that we are taking under our strategic plan should be framed under our mission, vision, and values. And if we called out any of these specific steps to say like, oh, we should address the race equity plan or look at race equity, it felt like every single step needed to be look at race equity and look at gender equity and look at equity across every step. And so I think that was kind of the back and forth that we went through in board strategic planning. Lisa added the statement of, I recall also the discussions were a major part of every step of our work. Feel free to share.
I had actually forgotten that really important decision point, Katie, that where at the very beginning we were struggling because it kept coming up and kept coming up and kept coming in. And then finally we made an overall decision that to call it out in certain places would actually be limiting our ability to address it. And that instead we wanted it to be reflected in everything we did. But I'm wondering if to folks who weren't party to the discussion, is there a way that we could make that more apparent? I would certainly be open to input on that.
Let me go ahead. There are a couple of people that have their hands raised. Amy, did you have a question or comment?
Oh, thank you all for sharing that and discussing it. It is helpful to know. I think part of, as a funded organization through the COC process, I believe we have to submit a race equity plan and answer questions about a race equity plan. So it would, you know, to me, it would seem like that should start at the top then, and that the lead governing body in the COC reviewing those applications should have some similar level of responsibility, accountability as a funded organization. That's just my thinking on it. And I do thank you all for sharing part of your discussion.
Great, thank you. And I'm going to reiterate, I have a feeling we probably need to be able to document it more through all the thought process that we did use and follow through that. So that's a great call out, Amy, and we will continue to take that into consideration. Joan, did you have a question or a comment?
Just a comment, if I may. very similar to, that would actually echo 2 points that Amy brought up as, defining the geographic scope, but then also defining the equity goals. I think if we just, I think the point is valid, and I do recall, I wasn't always in all of those strategic planning conversations, but I do recall, a very, a conscious discussion of everything needs to have that equity lens. But so that being said, I'm just hearkening back to my grad school. I'm still in trauma apparently, that, you have to document your goals, you document your definitions, and then, you document it at the front, and then it kind of, with the assumption that it goes throughout the whole document. So if we define the geographic scope and then define our equity values at the top of the document, that might be, just really apparent, more apparent at the very least.
Okay, great. Thank you, good input. Any other comments? Any other questions that are out there, Katie, that I can't see?
I don't think so. I think you are good to go.
Okay, great. I would like to remind the board to please not use the chat box, as the individuals that are with us cannot read the chat box. So with that, we'll move on to the next agenda item. And it's time to review the charter. Once again, review of the charter will occur on an annual basis. Throughout the month of July, we were requesting an ad hoc work group to meet to review and make changes and bring feedback to the entire board at our July meeting. MAG staff will have been gathering feedback from subcommittees over the past month for the work group to review. Katie is going to send out a doodle poll to interested participants after the meeting to schedule time. The meeting will occur weekly for about 3 weeks in July. And do we have any volunteers interested in participating, or any questions from the board?
I definitely like to be part of the charter review. I know we have a couple things that are very current. What's the word I'm looking for? That we want to do right away.
Wonderful. Thanks, Ryan. And Katie, you can add these to the list too.
I would volunteer, Rob.
Great. Thank you, Danielle.
Friends, I'm just going to say this is going to be much easier than last year, because you all did it last year. So we made a lot of changes, and we've been documenting all the changes that have come up throughout the year. So hopefully it'll be pretty painless.
Should be just a couple little tweaks.
Great. And if anybody is interested after the meetings, please reach out to Katie to be added to the list. I'm getting you back, Katie. Okay, so let's move on to the next item. Last month, we voted to open the Regional Government Board membership seat. The work group met to review and bring forward a recommendation to the full work group. The work group recommends to add Sean Pierce, Deputy Director at Maricopa County, to the board. Members of the work group, do you have any comments or things to add? No comments? Great, appreciate that. Goes a lot of time involved in going through the selection process, so appreciate you going through that. Can I have a motion to approve adding Sean Pierce to the regional government seat?
So moved.
Second.
Is that Ryan? Second? Jackie was second, I think.
Yes.
Y'all are moving around on my screen, sorry.
Sorry about that.
Not you, it's me. Now I'll ask Katie to proceed with the roll call vote. Please indicate clearly how you vote, stating yea or nay once your name is called.
Ish Brown Gambino.
Yay.
Jacqueline Campbell.
Yay.
Liz DeCosta.
Yay.
Marshall Franklin.
Yay.
Lisa Glow.
Yay.
Chris Hallett.
Yay.
Joan Service.
Yay.
Charles is not here. Jackie Taylor.
Yay.
Danielle Wright.
Yay.
Co-chair Ryan Balch.
Yay.
Co-chair Rob Quadlager.
Yay.
The motion passes unanimously. Thank you and congrats, Sean. Back to you, Rob.
Great, thank you. I think we are about ready to wrap things up. Do board members have any action or discussion items for future meetings they'd like to bring up? Quiet group today. Brian, I see you went off mute. Did you have a?
Sorry.
No? I tell you, we'll go off mute. I thought you had a comment.
Oh, nope. It was from the last vote.
Oh, okay. Okay. For the next agenda item, comments from the board. Is there anything anybody on the board has, or any other announcements or events that they would like to highlight?
Mr. Chair, I guess I do have a question. I don't know if this is the appropriate time. I probably should have asked it earlier on when Kelly was speaking. So if someone wants to slap me for not doing it this right time, just tell me. But Kelly had made it clear that we're going to take on this new NOFO for unsheltered folks. And I know that's going to be a serious drain on staff. And I'm wondering if there is any way, are there any additional resources? Would it be helpful? Should we be considering bringing on a temporary part-time help to get yet a second NOFA done? At the same time, we're doing our normal NOFA. Have there been any thoughts to what's going to happen here? And then my second question around that, if it's not the right time, then we can table this. But my second question around that is, will there be any consideration to a regional, since we're talking about unsheltered, might there be any consideration to a regional project approach?
Sure, Madam Chair and members of the committee, I'm more than happy to speak to that, or Madam Co-Chair. At this point in time, we will be relying on other members of MAG staff to help to complete the NOFO application and the work that goes into the NOFO, fully recognizing that our current team is at capacity with the existing NOFO and other responsibilities on their plate. We did consider bringing in out-of-house grant writers and consultants to help with the work. However, because this work is so nuanced and there's such a level of general intimacy with understanding the programmatic side of this work, we feel like we need to have other staff complete it to be able to work closely with our existing staff to not overtax, if that makes sense, to not provide too much extra work for the existing staff. And so at this time, that is our plan. We thankfully have a successful recipe for how to execute a NOFO. As you're all familiar, our last NOFO application was the highest scoring that we have ever received at MAG. And so we anticipate following the same model for putting out a call for applications, asks, following a timeline, establishing a rank and review committee, et cetera. That's the plan as of today, recognizing we've had about 5 days with this information under our belt, and we are fully willing to change our minds. So we will just keep you all in regular communication as these decisions get made.
Okay. And I guess I would just say to the board and to committee members and to, the membership at large, it is that if there's any way that we can be of assistance, getting out 2 NOFOs at the same time is a heavy lift. So if anyone has ideas, is willing to help, if you guys have ideas about how we can help. So I appreciate that answer, Kelly. Also, will there be any consideration to a regional project or approach of some kind?
I think we're definitely open to that. Absolutely, Madam Co-Chair. At this point, again, we're in the process of reviewing it. I think we'll have more of our questions answered tomorrow after the national webinar and Q&A with technical assistance from HUD. And then we'll be able to reassess how we're going to put the ask out to all of our COC partners and other stakeholders. I think at this point, anything is on the table. We're just really interested in bringing in those extra dollars to try to address the increasing unsheltered population in our region.
Is that webinar only for collaborative applicants, or is it open to all?
it is open to all, and we'd be more than happy to share the link if anybody is interested in attending. Tomorrow, it starts at 1:30, 11:30 on our time zone. It's for the general unsheltered population. And then on Wednesday, for anybody who's interested, it is the rural funding that's been set aside in the same.
I think it would behoove all of us who are concerned about or work in the space of specifically people who are unsheltered to pay attention to that and to just put our thinking caps on and reach out to each other and try to figure out how we can get this $60 million into our region. I think we have a very good shot at that, given our statistics or our data and our also our, you know, how regional we have been and all of the new infrastructure we really have in place that, you know, has come about, I think, largely out of the pandemic. I think we are so much more coordinated now. And so I think that would be this might be a great place for us to start.
Madam Co-Chair, if I may just add one other additional comment on this.
Please.
There was a great article in the New York Times this weekend about how more states are looking to Medicaid dollars to help address homelessness. And Access was actually called out as one of the 3 states listed as an example for creative funding when it comes to addressing both substance use and mental illness among individuals who may be experiencing homelessness, and how Access is going about applying for an additional waiver for funding. And so I just add that to the conversation because I do think some really innovative, great things are happening out of our state Medicaid agency. And I think it's appropriate for us to keep them in mind as we're talking about addressing the needs of the unsheltered population in our region.
Thank you for that, Kelly. I did see that it was a great article. Maybe you could share it with everybody.
Be happy to. Thank you.
And maybe we can make use of that in our application. Thank you.
Great. Thank you. Thanks, Kelly. Any other announcements or comments or questions?
I just have a very quick comment, just circling back to the conversation we had with Amy about the strategic plan and aligning with race equity work. I think it would be a great asset to us in adding some type of statement to the strategic plan around race equity if we engage the leadership group on that. I don't know if we actually had them review the strategic plan or had their input in it, but I think this is a point where we could possibly draw them in and get their recommendations on creating some type of overall statement around our thinking and intention and weaving in race equity and all of those levers that we discussed in the strategic plan.
Okay, good point.
The other thing I was just wondering when Amy was asking her question earlier is that we do have a race equity plan in our continuum. And so.
Yes.
Right?
Yeah.
Maybe what we need to think about is how we're linking that work. And maybe we're not being apparent enough or transparent enough.
Transparent and clear. Yep.
Yes. I mean, we have a very robust race equity plan. And we have a phased approach to bringing the race equity work into applications. And so maybe we haven't talked about that enough or brought it in somewhere that we could link it up or something.
And aligning the two. I think, I don't think it would be a heavy lift, but asking the race equity leadership group for their recommendations on it, I think would be helpful.
Great idea.
Okay, great, thank you. Good suggestions. Anything else to add? Any other comments? Great. With no further business, then the meeting is adjourned. Thank you. Have a good day.
You as well.
Bye, everyone.